very near and dear to my heart, the Acorns unit. So I will let you all, Chief, you were hiding on me there. I couldn't see you.
Not
You'll
intentionally.
start us off. Thank you.
Absolutely. Good morning, Mayor and Council. Happy Tuesday to everyone. And thank you for having us today. As the Mayor stated, we want to talk to you about our Acorns unit, our Assessing Crisis through Outreach, Referral, and Networking Services unit. This unit has been in existence for just a short period of time, but they've done a tremendous amount of work. They're well known throughout the city. So today we want to talk to you about the unit itself, just give you a little bit of background, talk to you about the mission, vision, and goals, as well as the report of the RTI study that was released last year. And then we want to wrap up with just talking about our recommendations that we have for expanding the unit. I have members of my team here today that are going to do the heavy lifting. They're going to do the presentation and speak to you. So I'm just going to do introductions of them, and then we'll get started, and we'll have a Q&A at the end. So first we have Lieutenant Renee Lockhart. She is the commander of the unit. She's been with RPD 20 years. She's well credentialed for this position. She has a master's degree in social work from NC State, and she has been with the unit since the inception of it. Next to her is Detective Wendy Clark, who has been with RPD 18 years, and she works very closely with our community partners. Everybody knows Wendy, loves Wendy.
Yep.
And it's because of her care and compassion that she shows in every interaction that she has with members of the community. Wendy was part of the original team, or the original planning team, when Acorns was being developed. So she has a lot of institutional knowledge there. We also have Senior Officer Maddie Horner. She's been with RPD 16 years, also well credentialed. She has a bachelor's degree in social work. She has been out and about in the community quite a bit as well. You might recall last August we had our community services fair at Moore Square, and huge success there. Maddie was the person who put that together and executed it well, so we're thankful to have her on the team. And then also to Chelsea Levy. She is one of 3 of the social workers that we have assigned to the Acorns unit. She brings a wealth of knowledge as well, and she's been with the program, and with the unit rather, since its inception back in August of 2021. We actually started in June of 21, and we hired our social workers in August of 2021. So at this time, I'll turn it over to Lieutenant Lockhart. We'll do the presentation, and then we'll open it up for questions.
Thank you, Chief. Good morning, everyone.
Good morning.
Acorns. Acorns means addressing crises through outreach, referrals, networking, and service. And what we like to say about the team is that we understand the need to foster growth, patience, relationships, and understanding with our community. So our focus is actually homelessness, mental health concerns, and substance use issues. The allocated positions currently for the Acorns team is the lieutenant. We do have a sergeant's position that is currently vacant. We have 1 detective, 3 officers, and 3 social workers. The Acorns team actually launched in June of 2021 with the sergeant, detective, and officers. And then our social workers joined us in August of 2021. What I like to say about the social workers is they provide case management. Their primary goal is care navigation and coordination, because there are nonprofits and community partners in the community that actually provide the service. So in the Acorns department directives, it actually states that the Acorns team does not provide diagnoses, counseling services, or health care to individuals. We provide the referral because we do have community partners that we work with on a regular basis that do that. We are a part of the Wake Continuum of Care Network, which means we have lots of partners that we work with on a regular basis. So our mission, our vision, and our purpose. So our mission is to connect with individuals in crisis and assist them with locating the resources needed to meet their individual goals and transition to long-term stability and reduce recidivism. Acorns actually sees people, okay? We are all passionate about what we do, and we're making sure that we are seeing the people behind the homelessness, behind the mental health concerns, and the substance use issues. So our vision is to grow a community of support of marginalized and vulnerable populations, specifically those impacted by homelessness, living with mental illness, and living with substance use disorders. Again, that's why we've built this partnership with other nonprofits and county and city partners. Our purpose is to establish long-term stability to improve the safety, health, and well-being of individuals, their loved ones, and the community. We at Acorns understand that we are in it for the long haul. We know that it is it's not a sprint, it's more of a marathon. So we're going to make sure that we're doing the best we can, considering the individuals. So when it comes to mental health crisis, now remember, Acorns is about homelessness, mental health, and substance use. But I know there are lots of questions around the mental health crisis. RPD actually has the crisis intervention team. We have trained officers who respond out to the mental health crisis when dispatch determines police are needed. As the Acorns lieutenant, I serve as the RPD CIT coordinator, so I'm the point of contact for Alliance and the surrounding mental health service providers. We also at RPD have the Crisis Negotiation Unit, and they respond to calls for service that include barricaded subjects and hostage situations. Also, Wake County EMS has an awesome program. It's the APP program, the Advanced Practice Paramedics. They've actually been in existence for 14 years. And these paramedics respond to mental health, substance use, and any acute care calls. And they've actually been working in partnership with Mobile Crisis for the last 4 years. So they have housed within their station clinicians that can then respond out as a mobile crisis unit as needed. So it's important that we know about them as well. So when we talk about our population, the population that we're serving, we at Acorns understand that there are lots of barriers that they face on a regular basis. And we spend a lot of our time, again, connecting and providing the care navigation for those individuals. For instance, in Wake County, in the city of Raleigh, if someone's facing homelessness, the first step for them is to actually enter the access hub. So they have to start there first, basically, and get in line, and then they will be assisted by a service provider. However, there are some things that our folks don't have that even starts the process, like an ID. I can give you an example of an individual that we've been working with since October of 2021, where our social worker was able to assist him with filling out the paperwork to receive SNAP benefits. But the benefits were denied because of lack of documentation. The social workers were able to continue to work with him. An Acorns officer even assisted with locating a birth certificate out of Europe. Now, this individual, he thought he was born in the United States. He did not know that he was born elsewhere. We assisted him with locating that documentation so he could just start the process of getting SNAP benefits, working with immigration, setting up appointments with immigration in Durham, and transporting him to Durham to get assistance. He was able to get his Social Security card finally in December of 2022. Still working on that ID card though, but at least we have kind of gone with him and there's been progress in helping get what he needs. Another example would be our detective working alongside university police when we have someone who has some concerning behaviors, not necessarily escalated, but we want to make sure we're keeping our eye. Our detective has been able to build rapport with this specific individual and actually make connections with his family and everyone else so that everyone knows what's going on in the midterm. Another example I can give you is Acorns was given a referral for someone panhandling on Glenwood Avenue. Initially, the subject refused Acorns assistance. It is voluntary, so it's not mandatory that we work with someone. And might I add, there was some very colorful language in that. But he did actually reach back out to the Acorns officer later, and that officer actually takes him monthly so he could receive his medical shot for his medication. We did find out that he was getting services in Charlotte, decided to come to Raleigh, and we reconnected him with that same service provider that has offices in Raleigh. So we were able to do that as the Acorns unit. So as mentioned previously, we have lots of partners that we work with on a regular basis. We end up connecting or reconnecting individuals to the service providers that are out there providing the service. Just want to give you an idea of the data of the calls that Acorns has actually initiated. So as of right now, Acorns is not 911 call driven, which means we monitor the radio, we have computers, but dispatch does not call us out. What actually happens is we determine when we go out and we initiate the calls for service. So since inception of the social workers and up to the end of the year last year, we had 1,035 calls in CAD that we initiated. The top calls for service for the Acorns team were follow-up investigations, and that means that could be overdoses, that can be mental health, check on welfares, things of that nature. We also, the second call class was request for service, and those are more transports and connections to services that are in the community. And then also, the third highest call for us was attempt to locate. That could mean a missing person. I'm sure you all are familiar with the public's concern for Mr. Polite. We were involved in trying to help and locate him. And then also the encampments that are out. These are all type of attempt to locate situations in which Acorns follows up. So as far as some more quantitative data, we have so far 546 contacts. We do call them contacts. These are individuals that we come in contact with. We don't diagnose or anything, so they're not our patients, they're not our clients. They're just individuals that we come in contact with. We have 86 release of information forms signed, and what that means is we've built rapport with these individuals in which they are willing for Acorns to work with their service providers on a more detailed basis and talk about their care and their plans for their care, okay? Now, Acorns receive a lot of referrals from patrol officers. We received 398 referrals from patrol. Now, even though they give us a referral, that doesn't mean that we're not coming out on at the time of the incident, okay? We try to follow up within 24 to 48 hours, but a lot of the times we're actually getting calls to respond out when officers are on scene as well. As you can see, we have more contacts than we have referrals. So what that also means is that my folks who are doing the work are out in the field. That's how it's set up. They're out in the community with the individuals that need the services. So we've been able to permanently house, of course, we don't have the funding for that, but connecting people permanently to housing, we've had 9 of those since we've been in exception. We've one of those relocated back to Georgia, but everybody else is currently permanently housed here in Raleigh, Wake area. We've also reconnected 7 individuals to their family and support network. That means they may have initially come to Raleigh. We had one specifically who ended up being a missing person because he came to Raleigh to get services, mental health services, and then was released out the front door, and his family reported him missing out of another city, and we were able to reconnect him with his family. So we have 7 individuals that we've actually been able to either connect with family out of state or even connect with family that is in the state of North Carolina. They just weren't originally from Raleigh. 3 of those folks came back to Raleigh, and that's okay because we're working with 2 of them on a regular basis. We know that happens too. We're prepared to, walk on a journey with someone, which we know we can take 3 steps forward. There may be 2 steps back. And again, it's their decision and their journey. We're just there to assist them along the way. I know there are lots of questions usually about other co-responder models, and Raleigh is familiar with them. We are familiar with CAHOOTS. We're familiar with the STARS program. And actually, before the launch of Acorns in June of 2021, in October, the Research and Planning Unit took a lot of time to benchmark and research and talk to these other departments, other agencies, and what they came up with is what's best for Raleigh. And what we did, not we because I wasn't here then, but what Research and Planning did and the other folks did was actually come up with focus groups and work groups here in Raleigh to work with internal and external stakeholders in determining what was best. And that's how we came up with Acorns. So as the chief mentioned, RTI, the Research Triangle Institute, did actually do a research on the Acorns pilot. And what they actually said was they were actually very impressed by our model in which we allow service providers quicker service delivery and we connect individuals to those service providers. They did say that if we were allowed to integrate with 911, we could then be dispatched to certain groups of calls, which would also allow for us to continue to do the care wraparound navigation system that we're currently doing. The recommendation was also to expand the ACORNS program. So what we are asking for is to expand the ACORNS program with a social work supervisor and then also 3 additional social work positions. What we're thinking about doing is actually housing those 3 social workers in the busiest districts that we have here in Raleigh, which include the Southeast District, Downtown District, and North Districts. Those are the ones that ACORNS have seen the most activity from. And so that is our recommendation. And I provided the ACORNS main line in our email address. We do get a lot of referrals from citizens calling concerns, and we man the line. We as in me, because I'm the only one in the office. Everyone else is out and about. Or we receive emails, and we follow up with citizens who have questions about ACORNS or maybe want to get some assistance for their loved ones and don't know where to start. We're the start to help them through that. So that is my quick presentation, and if I could have my folks kind of stand up here with me, we'll open it up for Q&A.
First, before we begin, I just want to say thank you. This idea was born out of my first attendance at the U.S. Conference of Mayors in January of 2020. And I'm going back to the U.S. Conference of Mayors this week, so watch out. I don't know what I'm going to come back with, but it'll be something good. But this has been amazing, the work you're doing. Now, I just want to tell a little story about Wendy, since the chief had mentioned that she knows everybody, and this is how I met her. We had a couple living in the bushes at our place, at our community. They were there for about 4 months, and the weather started changing, and my husband was concerned about their safety. And he called the commander and said, listen, this is a lovely couple. We want to see something positive happen for them. We don't want just a police officer coming. We don't want them to be scared. We want them to be cared for. Wendy showed up. They knew her, and she said to them, so this is where you've been all this time. I've been looking for you. She said, come on, let's go get you some of the care you need, whatnot. And they said, sure, we'll always go with you. That's called building trust. My husband and I looked at each other and said, wow. The rapport, the respect, and what you've built in the community, and I've since seen your interaction with others, it's amazing. So I just want to say thank you, not only to you, but to all of you for making a difference in the lives of people who need the help the most. All right. Councilmember Branch.
So first of all, thank you. I know, Lieutenant, we talk often, and we know why that sergeant position is vacant, because you were sergeant and you were promoted to lieutenant. So we'll definitely see how the chief goes about fulfilling that so that you don't have to answer all the calls. My question is around the transport piece. I know you said the officers work in transport. Have we, and this may be an idea, of connecting with our Go Access program to possibly help with some of that transport? Because there's only 3 of you right now, and as we grow it, I'm sure there's some overlap where multiple people may need assistance at the same time, but they're in the position where they're not a safety risk, or anything where they just need a ride. And I'm thinking maybe through our Go Access program that we have, maybe that's an avenue that we can look at. So that's the one thing I kind of wanted to mention as an idea. And again, I know you need more women and manpower, and I hope this council will do what is right in making sure that we get in front of helping people and not having to react to helping people.
Councilmember Branch, I just wanted to tell you that we are working right now on a van service that will work with social workers, not only our Acorns unit, but also the Downtown Raleigh Alliance and the social workers they have on the ground, Triangle Family Services and others. That's been in the works for about, 2 months?
Yeah, 2-3 months.
Yeah. So work is starting on that. And when we mentioned that on a DRA meeting that we had, a tour of downtown, the social worker, like her face lit up and said, if you can do that, that will provide the support that people need. That's their biggest challenge, she said. So we're on
The
it.
chief asked me to mention that Acorns, we are working on our vans as well. So we are supposed to have 3 vans that we have coming up, and a mobile office too. So our social workers can do the care navigation that they.
Yep.
Yes.
Councilmember Fort.
Thank you. Thanks for the presentation, and appreciate all the hard work that y'all do. I know that there have been some incidences when I was a district rep in D that we had to utilize your services, and so appreciate your fast response. I guess I have a couple questions more so around data. I don't know how much y'all collect and how specific it is, but do you have any data about folks who have been brought to the Raleigh area to seek services because the word is out that we do such a great job with providing services that people will bring people from other areas? Do y'all kind of track that data of people who are not necessarily Raleigh residents, but they end up here and y'all have to provide services? So that's my first question. And then my second question is around how much do y'all track data as it relates to encounters with folks who are having mental health crisis?
So to answer your first question, we don't have the hard data, but the majority of the folks that we come in contact with are new to Raleigh, that we're working with on a regular basis. And our transit unit folks will tell you there are constantly folks coming to Raleigh because Raleigh's the place to be. And so they're coming here looking for those resources. So a lot of the folks, our contacts that we have listed, are new folks to the area. Your second question was?
Do y'all track encounters with folks who are having mental health crisis? And do you have data for that?
So I don't have the hard data to give you, but as a CIT coordinator, I do receive the reports that officers take, and also our detective actually gets reports that are related to mental health crises as well, so that we can kind of see what's going on. And also Detective Clark does a great job of following up with families after the crisis to see how we can mitigate that so that it doesn't continue to happen in the future. So we're doing a lot of that. One of my asks has been a database so that we can get that hard data fast and quick, and it be Acorn specific, so that not everybody within the department gets the information, but our unit and personnel gets it.
So Chief and Madam City Manager, what do we need to do to help them get the database?
So let me remind the newer council members, or inform the newer council members and remind some of those that have been around for a minute, we appropriated $800,000 in this year's budget to do just that. So for some additional staffing, as well as some of the necessary technology that they will need. So I've done my part. You guys did your part. It's on them now. So, and
like
for
the
the new
manager
folks,
just
I know you didn't know that when they put up about staffing, but you all will recall that last year we put forward $2 million, 1.2 for the police, our interceptor program, community violence interrupter, and then 800,000 for the expansion of the Acorns unit, because that was one of my goals last year.
And Madam Manager, thank you for that plug. Now that we've gotten the funding, we will work on getting that database. In fact, we already have one in mind, so we're just going to work towards that.
Okay. And Councilmember Ford, Oak City Cares is compiling data on related to your first question.
The same thing we've heard it from Kathy at Oak City Cares. We've also heard it from Bill at DRA that a lot of the folks that are on the regular roll now are people that have been dropped off at Moore Square or dropped off downtown, and it's not necessarily Raleigh natives. And our perspective is we provide help to whoever needs it. So there's no picking and choosing. But when you do look at the data that we're able to gather, a lot of the folks that are receiving assistance or have received it in the last 8-9 months have been out of town folks.
We had one instance where, I'm not going to name the community, but Sheriff's Department drove several hours and dropped off someone who had just gotten out of prison at Moore Square. And they were contacted, and I believe they came back and got them.
Yeah.
So, and we're seeing that happen more and more. People putting people on buses, go to Raleigh, that's where you can get care. Councilmember Branch?
Yeah, I also had an incident. We worked on an incident on Crosslink Road where someone was dropped off that we had involved the Wake County Sheriff Department with. But one of my questions is, of the 4 positions, just so I'm clear, they're already budgeted and they just got to fill it, or do we need to do a...
Yeah, we just have to approve it.
That money's already been appropriated, so they
Okay.
can go and staff up the program as they see fit.
Cool, good.
Yep. Councilmember Jones?
First, thank you, Lieutenant Lockhart, for coming to my Girl Scouts troop last year and allowing us to be involved in that. I have the girls still asking, we're about to start cookie sales and we want to start partnering with different organizations, so I'll reach out to you on that in a later date. The question that I have is just a clarifying question. I know you mentioned in the report about 911 service. Are you currently working on 911 calls actively, or is that the extent of where we want to grow to where you are partnering with 911 calls?
So we are not 911 driven, so we are not being dispatched. However, we are monitoring, and they can speak better to this than I, but we will check in with an officer. Like, we have our radios and we have MCTs and everything. In the future, that may be something that we can consider, as long as it's not taken away, because I'm limited in my staff, as long as it's not taken away from the care navigation that we're providing right now. When we have additional staff, we can actually be able to be dispatched to certain groups of calls that would be helpful to patrol as well.
So goals in the future.
Yes,
Got it.
exactly,
Okay,
exactly.
thank you so much.
But I think we probably need to clarify, too, that they do go on calls. If there is a call where there is a need for somebody that's in crisis or somebody that's dealing with a mental health issue, these individuals do respond to that. Yes. They go to it. Yes. So they just don't sit in the office and wait, as Lieutenant stated. They will go out on those calls and assist. And the officers, they know the routine by now. They will call us up front and say, we need to have Acorns respond to this call.
Yes.
Thank you so much.
Any other questions? Councilmember?
Yeah, thanks so much for the presentation. I have a couple questions. One of them, I'll just put them all out, and then you can kind of take them in whichever order. So one is about, you mentioned reducing recidivism. Do you have any metrics on that, or is that, I know it's difficult to measure something that doesn't happen, but I'd love to hear more about that. And then my other question is around, if you could just speak a little more to, you mentioned the focus groups and the decision to go with the model we have here versus some of the other co-responder models. I know that predates your time, but if maybe someone could speak to how you assessed and what brought the team to this model versus the others.
Let's start with that question.
When we started with the development of the unit, what we had envisioned turned out to be something very different than what we have now. Because once we got out there and saw what the need was and how we were going to respond, that changed the dynamic of the way the unit worked. Now, when we were developing the unit, we did speak with multiple agencies. We did the benchmarking where we looked at different co-responder models. And that was originally what we were going to go with, some of that. But we found out quickly when we started working on the stuff that we were having more success with doing more of a wraparound service. And we could respond to the 911 calls. It's putting a Band-Aid on it. So you respond to the original crisis. What we're doing is we're coming in on the backside. We're coming in on the backside. We're making sure people are connected with resources or getting them reconnected with resources and making sure that they're getting from point A to point B so that there are not repeat calls for service.
Could you speak to the reducing recidivism as far as the detective in your role in working with Wake County Courthouse and everything you do there?
So I guess the big picture with that is more of if you get them connected with services and you get them stabilized, less likely you are to have the repeat calls for service. Also, when you go in and work with the courthouses sometimes, so we have some DAs and some PDs that we work with that we're able to go in and, at least in the past, I was able to go in and say, we were able to get them connected with services. They're getting medical assistance and mental health assistance, and this is the direction they're going in. So not for calls that are like assault charges, but more of nuisance kind of charges such as urinating in public, panhandling, sleeping in the park, different things like that, where they're able to work with us because we all want the same thing. So we all want them to be successful and stable and able to maintain.
Councilmember Jones.
I saw all the organizations that you worked with, and that's amazing. I've been able to meet with a few of them, and it's great. I'm wondering, is there a need that maybe that you guys have recognized that is not met by all of the organizations that you partner with? Is there an outstanding need that you're like, man, if only we could help solve this problem?
Housing, absolutely. So a lot of the things that myself and my other social workers are running into is that there are bountiful amounts of vouchers, whether that be your typical Section 8 or an EHV, which stands for Emergency Housing Vouchers. The bucket is full of those, but there is nowhere to house them at. There is almost no affordable housing in the city of Raleigh. And so those vouchers are actually being recycled back to Raleigh Housing Authority, and those people are finding themselves still experiencing homelessness. I've had a few people that you can only extend for up to 120 days. I can advocate and get them extended, which I have, thankfully. We still had one gentleman, though, that unfortunately had to pass up his entire voucher, which the wait list for is 5 to 7 years for a typical standard Section 8 voucher. And then he had to give it up because there was nowhere to put him. Granted, we're advocating for some barriers in housing, which maybe some criminal history, things like that, but that's where we come into play, being able to advocate for those people that might be harder to house.
Evictions as well.
Evictions as well, yes, poor credit history, things like that. However, we do work with Wake County, the Landlord Engagement Unit, and they have been a huge help to us to find private landlords to house people that might have those barriers, but there's just not enough to go around. A lot of people are having to turn back in their vouchers and get back on the wait list and just cross our fingers. That is our one blaring outstanding.
And what happens while they're waiting for on that wait list? Where are they?
On the street, in shelters, hotels, self-paying hotels. I have a lot of contacts who are receiving their disability checks every month, and then they are using all of it up in about a week and a half on hotels because it's cold. There is white flag, but a lot of those that have been in shelters for years and years, they just don't want to return. Every shelter has different sets of rules and guidelines for leaving, coming back in, if you have to leave at a certain time of day, and some of them just don't have the ability to move around like that. So they do, there are a lot of places, but they're not sheltered.
Thank you so much.
Yeah, thank you.
And if I can add to that too, just recognizing the need for housing. One of the things Lieutenant Lockhart talked about, and she and I have had conversations, is again trying to reconnect individuals with their support systems. If they're not from Raleigh, if there is a family member somewhere else that we can connect them to so that they can be housed, that's an option too that we're really exploring and doing the best we can with them.
Mm-hmm. Thank you. Councilmember Patton.
Sorry. Are you encountering the same challenges filling these roles here as like some of the other staffing issues that have been that are facing across the city? Is it easy to fill these roles and we just need money and time to do it, or are we also struggling to find staff to fill these roles?
As far as the social worker positions and officer positions, I think we when we get them, they will come. So I was able to participate in one of the position processes, and we had lots of applicants. There is competition though, because right now social workers are needed everywhere, and so we are, we want the best of the best, right? And so there's a lot of competition out there, but I do know that we can fill those positions. And yes, we do have officers that are also interested in joining the Acorns team as well.
All right, no other questions? One last thing I want to leave you with. If you notice that, all three of our members here are clothed in civilian clothing, that is how we approach when we're out in the field. Because again, we want to take that stigma. We want to put people at ease when our Acorns unit is interacting with them. So as you see them is how they do their jobs every day, and we're happy to do that. Lieutenant Lockhart is in uniform because she's the commander of the unit, but everyone else is dressed down. Okay. Well, thank you for your time so much. City Manager, is there anything else that?
No, I think you all did a good job, and let's get some folks hired.
Yeah. Thank you.
Thank you. Okay, we are now adjourned, and we will be back here at 1 o'clock. Thank you. Christina?